Well, now many in the medical community are speaking out, saying there is no definitive link between acetaminophen and autism. And one of the medical professionals that is speaking out is fertility doctor Lucky Secorn with RMA of New York. She's also the author of The Lucky Egg and has some fun on social media. Take a look.
In a city of drama queens, I'm the queen of fertility, and I tolerate zero drama. Results, not rumors, are my game.
Are you working? What kind of work do you do?
It's nice to see you having fun, doctor. Thank you so much for joining us here. You're also a mother of two. I'm curious, we have fun on social media, but I'm curious, what are you hearing from your pregnant patients and new moms who are hearing conflicting information from the White House and the medical community about acetaminophen and other things?
Well, I think in moments like these, it can be very challenging to be a pregnant woman because you feel torn and conflicted. And there's a lot of confusion and mixed messaging. I'm getting a lot of questions. I think anytime someone sows any sort of seeds of doubt in the mind of a pregnant woman who has been told time and time again, Tylenol is safe, make sure you're treating your fevers, make sure you're staying on top of this, it is a natural tendency to question it. And I think, what's been helpful in the past few days is that the large medical societies that govern and put forth recommendations on how we practice and are very evidence-based, like the American College of OBGYN or the Society for Maternal Fetal Medicine, have come out and had very strong statements saying there is no new data to base these statements on that came out of the White House. And based on the best design studies that we have available, we stand by our conclusion that Tylenol is safe and recommended in pregnancy. And I think you have to also question, what is the alternative? We know that using other types of pain relievers that we would traditionally turn to when not pregnant are not safe in pregnancy, like Motrin, Advil, ibuprofen. Those are all the same type of drug. Mm-hmm. And we know that that can lead to birth defects, even though it is an effective pain and fever reliever. And, there is no new data. The best study that we have available came out last year. And, it included over 2 million children, and it did a really great job for controlling for environmental and genetic factors and really found no association. And, this is a challenging time, but I think women need to listen to the science and really trust doctors and medical experts who are well-versed at interpreting scientific data.